Good morning. WLBT's Ask the Experts is now live from the Hub. I'm Kelly Boyd, and joining me today, back again, is Commissioner Mike Cheney with Mississippi Department of Insurance. Thanks for coming back to see us.
Good to be here. Thank
and
you.
answering all the questions related to insurance. Today, you're going to talk Health Insurance 101, right?
Health Insurance 101
and non-discrimination.
Non-discrimination.
All right.
So that should be an interesting topic for us today.
Sure. So the questions that we have for you come from our Ask the Experts page on WLBT.com. But if you have questions about health insurance and anything related, ask Commissioner Mike Cheney while we're live on Facebook. Good with that?
Good. I'm good with that.
Did you notice we've changed our colors in here a little bit?
You have. I see pink, and I had a pink shirt to wear, and I don't know why I forgot it this morning.
Oh, no. So you do know why we're pink in the Hub for the month of October?
I do know why you're pink today.
Great. Breast Cancer Awareness, our 13th year for Power of Pink with our sponsors, Baptist Cancer Center.
We have all of our female fire marshals and the male fire marshals in pink at the fair. So we wore pink shirts. Yeah, we did very well.
Sadly, I did not get a chance to go this year. Very busy.
We distributed a whole lot of information about insurance and fire safety at the fair.
Really?
Really, it's
a lot of
good
people.
Event. Very good event. A lot of people, a lot of seniors, a lot of kids, and things that need to be told to them, and education that they don't get in the school can be given to them right there at the fair.
Great. And the firefighters wore pink to give it out.
The firefighters wore pink, and it was great.
Yeah.
We had a lot of comments about the pink, so it was good.
I bet. Good. All right. I don't see any questions over here yet. Susan Stevens says good morning. Good morning, Susan. Thanks for joining us. All right. You ready for the questions?
I'm ready.
All right. What are benefit exclusions?
Well, a benefit exclusion is something that's excluded from your insurance policy, and it ranges from a type of drug that may not be covered by your insurance carrier to a type of surgery that may not be covered. And that could be cosmetic surgery, which normally would not be covered under your insurance program. So these exclusions can vary from plan to plan and from company to company, and therefore it's essential that you know what's in your plan. And we tell folks every time they call us about insurance, health insurance specifically, read your plan. And we have 200,000 people in the state health plan. And I serve on that board, and we say, please read your plan explanation so you know what is and is not covered. If you have doubts about what your doctor is recommending to you, take the plan with you to your doctor's visit so he'll know what is not covered. Of course, they won't read it, but you still I'm not putting doctors down. I'm just saying they're so busy they're limited in the time.
Time that they have, which is I know you've recommended before to have that list of questions handy when you go to the doctor.
Yeah, always have a list of what you want to ask the doctor, and if you heard here or there or wherever you want to ask them, it's like, wow, what's the deal?
Bring that with you. So that stuff about benefit exclusions and what is and is not included can be part of that set of questions you should prepare before your doctor visit.
And if they recommend a drug to you, say, is that drug on the formulary? And you can print your formulary out, and we'll get to what a formulary is in a minute, but it's essentially a list of drugs that your insurance company will cover.
Okay.
So we'll get to that.
All right. What are cost-sharing provisions?
Well, the cost-sharing provisions that your insurance company tells you this is what will be covered out of pocket by you. And that's the other part is what would be covered by the insurance company themselves. And this term generally includes, and I'm going to read this because it's really, really important. It's deductibles. It includes your co-insurance and co-pays that you have to pay out of your pocket or similar charges, but it doesn't include your premiums that you pay for your health insurance. So that's a little different. Balanced billing amounts for our non-network providers. Or you're not supposed to do that in the state of Mississippi if you assign your health insurance to your health care provider, be it a hospital or a physician or a PA. They cannot balance bill you if they accept the insurance. Or the cost of non-covered services. So that's what we call cost-sharing provisions. You'll have some services that are just not covered by your insurance policies.
Okay. All right. Who determines, well, first, what is medical necessity?
Well, a medical necessity refers to a decision by your health care plan or for your treatment, or that your test or procedure is necessary for your health and your well-being. Now, a lot of things people want to cover, like cosmetic surgery and so forth, are not normally covered. That would be Botox. A lot of people want to take Botox for their eyes because they get wrinkles like me. I'm a pretty old fellow. And I try to show you some on the air here, but Botox is not covered generally unless it's for a health reason. So when we talk about what is a medical necessity, cosmetic surgery would not be covered in most cases, but what would be covered are health plans that think that you may need a hip replacement or a knee replacement or a certain type of medical procedure. They would normally be covered. That's why it's really important to read your health care plan and to look at the documents that your health insurance company gives to you. So most health plans will not pay for health care services that they deem to not be medically necessary. And remember, that can be things like cosmetic surgery, and that could include Botox or other procedures, facelifts, and what have you.
Okay.
Any?
Sure.
Okay, good.
So it's each insurance company that defines and determines what's a medical
Sure,
necessity.
that's right, Kelly.
And then
So
you'll check your guide.
The company, each insurance company will define and determine what is necessarily medically necessary for you, and some of them will be different. Some companies will cover things that others will not, and we've had a lot of cases where people say that we want this type of treatment because XYZ company covers it, but ABC company will not cover it. So you have to really look at your policies to know what's covered.
All right. What are prescription drug formularies?
So we mentioned formularies just a minute ago. A formulary is a list of prescription drugs, both generic and brand names, and generic are just another name for a drug that has gone off a patent. In other words, it's cheaper. It's the same formula, same quality, but it's off a patent, so somebody else can make it a lot cheaper and sell it a lot cheaper. But it's a list that the insurance company will have of the drugs, name brand and generic, that they will cover in your insurance plan, and it's used by practitioners to identify drugs that offer the greatest overall value. And that's a very complicated issue because you get into something called PBMs, pharmacy benefit managers. You get into rebates that the insurance carriers may get or the healthcare provider may get, including hospitals, from the drug companies for recommending and using the drugs that they manufacture. So it's a very complicated issue. I do not regulate PBMs or the drugs that insurance companies have. I do look at the formularies just so we'll know when somebody calls and says, my insurance company will not cover this drug.
Right.
Is there a specific reason? And we can say it's not on your formulary. So we look at the formulary to kind of know whether or not the companies are doing the right thing. We have begun a very aggressive program to ask some of the companies why they're not covering certain drugs when some companies will cover them and other companies will not. We want to know, is there a medical reason, or they're using a different set of standards? And sometimes it's just as simple as the rebates that they get from the drug companies are not as great. So we worry about whether or not the consumer's getting the right shake here. So, that's my job. I take care of the consumer. And we worry about the local pharmacists on the corner store not being put out of business by the big box stores, and I'm talking about Walgreens and CVS's. And I'm not knocking Walgreens and CVS, but you've got to be competitive in your price, and you can't use that largeness to put the local store out of business. And the idea here is that in Mississippi we have any willing provider, so you can go to any drugstore in the state and they should accept your insurance, and the prices should be very comparable.
Right. Okay. Well, you gave us a lot of information on that. Is that completely how, or is there more info on how drug formularies work?
Well, there's a lot more. They're split into two groups based on price, and they're called tiers. And you can have a tier 1, 2, 3, and 4. And to give you a quick example, tier 1 may be a $20 copay that you would pay on your drugs. Tier 2 would maybe a $40, and tier 3 would be a $60, and tier 4 may be as high as, let's say, a $100 copay, and that's usually for the highest priced drugs that you have, or specialty drugs that you might take for
probably not
chemotherapy.
a generic.
Not
right?
a generic.
Okay.
But now generics, so you can have generics in tier 4 that are still very expensive, especially on chemotherapy for cancer drugs. And if your oncologist may recommend something to you that's not generic, and those drugs are very, very expensive.
Okay.
Very expensive.
I think you answered our next question in answering that too. It was, what do different drug tiers mean? And you just explained there are 1 to 4
I got a little
tiers.
ahead of everybody there.
Good.
Kelly.
Well, you're very informative. Thank you. And I think we've already really talked about this too, unless there's anything to add to it. What are brand name drugs and what are generic drugs?
Well, a brand name drug is essentially a new medicine that has been developed by a drug company, and generally they will have a patent that could last up to 20 years. Those patents normally don't last that long, but the companies will renew the patent as long as they can. And then once that drug is off the patent list, then you will have a generic drug that will come out. A good example with that would be the drug Zantac, which there's a lot of advertisement about. Zantac used to be $3 for a Zantac, and you can buy 90 pills for $19 today at any of the big box stores or your local druggist. There has been some recent publicity about the fact that Zantac or the generic brands of Zantac may have something that would cause stomach cancer, but it's the most prescribed drug in the United States, has been for a long
And
time.
Zantac is for, like,
Zantac
is that
is for
heartburn kind
a
of
heartburn,
medicine?
and
Is
you
that
take
right?
it. It's for heartburn, and I take Zantac. The only thing I take is vitamins. Is I take a Zantac just as a preventive measure every night for you don't want to get esophageal cancer if you have heartburn. You can jack your bed up with a brick under it if you want to. If you don't have to worry about it. But
There's some advice for you.
so in my job, I may need a Rolade sometime, but it's cheaper just to jack your bed up. So if I have a Rolade, it's a big joke. I carry a pack of Rolades in my pocket, and if I have a bad week, I may eat 2 Rolades. So
A bad week is
if I
too
eat a bad
Rolades.
taco
You judge
somewhere.
your week by your number of
Rolades
Rolades
you have. So,
gone from your pocket.
what you look for are generic drugs are the same quality. They're identical to the brand name drugs in dosage,
The makeup.
safety, strength, quality, performance, and intended use, and they are sold at substantial discounts compared to what you would pay for the name brand drug.
Okay. All right. Do drugs covered on the formulary have any restrictions?
Yes, there are. You've got some what we call step therapy restrictions, and step therapy, there are 3 of them. Step therapy, prior authorization, and quality that are limited in how much you can get. So step therapy is where an insurance company will recommend, or your healthcare provider may recommend, that they start you out on a drug to see if it will work for you. If it doesn't, then they will put you on another drug. That's where we really run into a lot of problems sometimes with the insurance companies, because they will say, we are not going to cover that drug because there's a cheaper drug out there, and the doctor may say, but that drug that you recommended that's cheaper will not do the job that's needed for this particular patient. So that's called step therapy. And then prior authorization, you have a restriction that requires your doctor to obtain authorization to give you a drug. That's pretty important to you. And then you have the limit on quantity. Now, we've changed the law here in Mississippi on the quantity part. You used to have to wait to get, you may have a drug that you would refill on the 10th of the month, and then later on you may refill it again, a different type drug on the 25th. We fixed that for seniors specifically, where you can get all your drugs filled at the same time.
Okay.
So you may get 35 instead of 30, and that all levels out. The druggists keep a record of that so they know what they're doing.
Okay. Next question, what is prior authorization?
Well, prior authorization is a process that monitors the use of certain drugs. We're talking about drugs in this case, to ensure that they're prescribed in appropriate clinical situations. You don't want, especially on pain medication, you don't want too many drugs, too many pills given out. And we've run into that in the state of Mississippi. We had people that would get hydrocodone for 30 days when they only needed a 4-day supply. And a lot of the studies that we've looked at on what we call opiates, essentially, painkillers, show that if you get more than 4 or 5 days supply, that's when you get hooked. It's a mind-altering drug, so you get caught up in the middle of getting hooked on the drug. So those are prior authorizations that the insurance companies require so that they can monitor and be certain. They kind of act in a way of medical, but they do have medical people on staff, and they know what's going on. Could say that this is the number of pills that you can get, or the type drug that you should be able to do. And I also have a record of you may be taking a drug that may be interactive with another drug you're taking.
Okay. So when exactly is prior authorization needed?
It's needed because, a lot of the reasons you need prior authorization is for safety reasons too, drug interaction, and some of these drugs that may have safety issues. So prior authorization, when is it needed? Your practitioner submits certain medical information to help the insurance carrier make a decision. Your practitioner's office and you are notified as to whether or not the drug is approved by the insurance company. And that's usually a very quick turnaround. What we've tried to do, Kelly, is to tell the insurance companies, don't wait 4 days to give somebody approval. They can't wait that long. Give it to them essentially very quick.
Okay.
And we've got one company that just drags their feet, you know. We're going to tell them we're going to put roller skates on you to get a little faster. So, and if a drug prior authorization has been denied or not submitted, then you have the opportunity to go back and do what we call an appeal.
Okay.
And so you can appeal whether or not your drug was approved. That's pretty important to you. So we have an appeal process.
All right. Okay, let's see. That's covered the prior authorization questions. I'm going to take one from Facebook.
Sure.
Angie Edge Cotton says, not sure if this is a good question for you, but my husband pays almost over $200 a month for health, vision, and dental insurance through his job, which is outrageous to me. Is it possible to get just as good and more affordable insurance without going through his company?
It probably is it, but I don't. That's a group plan, so that may be a benefit that the company that he works for offers. But it's possible to buy the same insurance somewhere else. But generally speaking, most of the dental plans and the vision plans are pretty comparable in price. I try not to give an opinion too often about dental and vision. There's a dentist in my family, so I have to be careful as a doctor in the family too. But I say that you might want to look at what your benefits are on dental versus what they are if you didn't have dental insurance. As an example, under the state health plan, you can buy dental insurance. I'm under the state health plan. I'm also on Medicare. I'm not on Part B because I have my own insurance with the state, but I do not have a dental plan. And the reason is that I have a way to save $900 a year. I've said this, I think, on one of the previous programs, that I save $900 a year out of my paycheck, and it's tax-free. And when I run $900 of bills up, and that's usually 2 visits to a dentist, and that includes my wife's visits if she goes twice a year. And if you have any drug cost at all, which I really don't, but let's say that somebody else in your family does, then you would get that money back. And I figure 2 visits to the dentist twice a year by myself and my wife, and hopefully there are no cavities, anything seriously wrong with you, and one wellness visit to your doctor is about $800 or $900. That's about what it costs you. So it's cheaper just to save it in a health savings account and take it out tax-free and not buy insurance. Now, I don't know, Angie, if that totally answers your question. I have to dance around some of this, but I don't want to say they're not good investments, because in some cases vision insurance is, but as many glasses as I break every day, I probably need vision insurance. But most amount of reading glasses like this right here, little bitty ones, and I can use them.
And of course, it depends on if it's an individual plan versus
Depends on the
family
individual,
plans.
and if somebody has prescription glasses, it's that's a whole different ballgame. A good set of prescription glasses would cost you $600 or $700.
Right, and it depends on the company that you're working for too. Its size, the group size.
It does,
how
and
many
it depends
people
on the
are
group
paying.
and all the things that they have. And these are pretty. If her husband works for a company that's got good benefits, like vision and health, they do charge you for it. That's a pretty good
That's
perk.
probably worth the
Pretty good perk.
$200. But you can always shop around, right?
Yeah, that's $2,400 a year, and you might be able to buy 4 pair of glasses or whatever you got to do.
Isn't there a way for them to estimate, like the Mississippi Insurance or the Affordable Care Act, those sorts of programs? Your website, doesn't it have that information?
We have that information where you can go in and look at it and put what your estimated cost would be, and it gives you a pretty good idea whether it's a good buy for you or not.
Okay. Maybe that would help Angie too.
That helps you some.
To have a reference point.
www.mid.ms.gov, and when you go to that website, and it's on, I think it's on the screen. When you go to that website, you can just look over on the right-hand side to healthcare, and it's got proliferate everything. Now, I'm having to go to school at my age to learn about how to make these websites easier to navigate.
Really?
You know, instead of writing long paragraphs like I learned in school in English, so I wouldn't have to take bonehead English when I went to the state.
Everyone's attention span's a lot shorter.
So you do bullet points, and that's what we're changing our web page a little bit to where it's simpler to navigate and simpler to look at.
Good. Okay. Yeah, because you guys have a lot of information, I'm sure, because you have so much to give us each time you come. So I can only imagine how much is on that website. All right. Another question about drug formulary. Why is it getting rejected at the pharmacy?
Well, most of the reasons that the pharmacist will reject a formulary when you go to pick a drug up is because you may require prior authorization for a certain type of drug, and if you do, the pharmacist may deny you until you get the prior authorization done. The pharmacist may be submitting that claim under the wrong family member name.
Okay.
You know, it would be like, I'm pretty well up in age, so I can say this kind of as a joke. Let's say my wife were taking a birth control pill. It couldn't be in my name, not in the male's name. So that would be a good reason that they may turn you down. Does that make sense?
Sure,
It's kind of,
yeah.
I make light of that, but just it's a good way to say that you really would be turned down in that case.
Yeah.
So, and they'd probably
Wrong
turn my
person.
wife down, but you never know though. So, and retail pharmacists are only able to dispense up to a continuous 30-day supply. We did change the law this year to let them negotiate whether or not they could be all your drugs could be picked up at one time. So the druggists have worked all of that out. It's just made it a little easier, and we've allowed the pharmacists to say, you know, you can get a generic for $20 instead of the ad you see on television sometime of costing you $300.
Yeah.
You can get a copay and a cheaper generics for say $20. That's a pretty big deal. And when somebody's living on fixed income, it's important that they have alternatives to more affordable drug costs. And when you have to make a decision about paying your light bill or taking a health care drug that keeps you alive or your quality of life good, there's some tough decisions. And our job is to try to fix that for you, although I don't have the authority under the law to do all the things we'd love to do. And we're not trying to grow the agency, let me make that clear, but we certainly think that we need more authority to regulate what's going on in the drug business. Drugs constitute over 30% of your health care costs in your premium base for health insurance. And it's almost a legal way, and I know the companies will tell you they have to have money to do research, but it's almost a legal way to just steal money. It's I take a real dim view of the drug companies. There are a lot of good drug companies out there, but there are a lot of bad ones. And just read the paper. We've had people abuse the system. We've got a $500 million fraud case out of Hattiesburg that just broke last week when they arrested some of the people involved.
Wow. So yeah, I can imagine for most people it'd be tough, as you said, to fit into your budget a cost and a brand new cost. I hate to take medicine anyway, but to imagine, oh, by the way, this is a new $400 a month bill for you to take medicine every month.
Well, it's the fraud that goes on is trying to. I guess the company's all trying to make money, and what we're trying to do is to say, just be fair. Just be fair. There's nothing wrong with making a profit, but there's something wrong with charging someone $1,000 or $2,000 for a drug that normally costs you $10.
Especially if it's something they need to have.
And you got to have.
Yeah.
And metformin would be a good drug to talk about because that's a diabetic type 2 drug that you can take, and it's really cheap. And the drug companies have bought those formulas up, and they've changed them a little bit, and they charge you $1,200 for the same thing you used to buy for $10. So it's just it's outrageous sometimes.
Yes. All right. Question about medications. How can a person keep track of their prescribed medications?
Well, when you talk about if you got to know how you keep track of it, one of the things I do, I take vitamins all the time. So I don't know, doctors tell me it's not that good, but my son-in-law is a doctor and says you need to take vitamin D3. That's always good for you. So I've got a little box that says Monday to, a little white box.
A pill box.
Pill box. And I put all my little vitamins in there, especially when I travel, and I have to travel a lot in the job, so I know that I take my D and my E vitamins today.
Yeah.
And take my B complex and my C vitamins.
So at
the
end of the week, you fill it up for the week, right?
I fill it up for the week. Now, gummy bears don't fit in there, and I've been doing gummy bears, and I said, I hope nobody puts something bad in the gummy bear. But gummy bears are easy to eat and chew on, and you don't have to worry about swallowing.
As a snack?
That's a snack. It's a gummy bear.
bears?
You get C with zinc in it, and helps you prevent a cold. And speaking of cold,
the gummy vitamins.
The gummy vitamins.
And that they're actually they absorb in your bloodstream faster.
They do, and my own
benefit.
children got our grandchildren on them, and that's why I learned about them. They would say, "Papa, you ought to eat one of these. They're good."
I take gummies too.
So they like gummies, and they got me hooked on them too. But speaking of health and colds, be sure you take your flu shot. We're talking about health care and drugs and what really matters, but flu shots are important. A lot of people will not take them because it's so. The last time I took one of those, I really got sick. A flu shot can help you prevent the flu or a really bad case of flu. And too many people die of flu when it's so simple to prevent. Be sure when you go to your druggist, you can get basically get a flu shot just about anywhere, from the big box stores to your grocery stores to your health department to your local doctor and your health
They
care
all have
provider.
signs advertising
signs.
outside saying flu shot.
And your
Flu shot
insurance
here.
company will pay that copay. It's really cheap. Go get your flu shot. You can get one for, I think, I don't know what, my wife got hers at the drugstore, and it was $20, $30. I got mine at the state and from MEAs, and mine was free under the state health plan. So normally you would pay $10 or $20 for the copay.
Right.
That's a good investment. Good investment for you. So you asked me a question. I got off a track a little bit. So
No, you answered it.
okay, but I'll go back and talk a little bit about. Make sure that you check your plans formulary. You can do that on site with the company that you have. If you're worried about a drug, to see if it's a preferred drug for you. You should be able to get this information from your health plan that you're considering buying, especially with Medicare open enrollment starting immediately in October, going through November. Look on the proposed health care plan that you're going to buy in a Medicare if you're a senior citizen, and know what your formulary is, what drugs will be covered if you've got a drug that you're taking. You want to be certain it's covered if you're changing plans, and you want to be certain that your doctor's in that network. We've got places around the state. In North Mississippi, Humana had over 8,000 of their patients that were counseled by the hospital up in Tupelo, which we could not intervene and stop that, and they had to find other places to go other than the hospital or the 7 facilities that are satellites to the hospital. And actually, I'll just throw this out, the benefits under Humana were better than what those hospitals were getting under Medicaid, but yet they want to expand Medicaid. So some of this just doesn't make sense. We had the same problem with another company down in South Mississippi in Macomb. We had several hundred people that lost their insurance. And the problems we have is we'll have a lot of those 8,000 people will call us and say, but I can't see the doctor I've been seeing, that nobody will put them in a network. So that's really tough. If you've been seeing a doctor for 20 years and all of a sudden, no, you can't go see your doctor under Humana, what do you do? So we have counselors that tell you what to do, Kelly.
Okay. Good
And
to
call
know.
us, 1-800-562-2957, and we'll try to help you if you got questions, especially if you're on Medicare. This is the open enrollment, and you need to be careful about Medicare. We're off the subject a little bit, but you just need to understand that if you have Medicare and you change to a Medicare Advantage program, you cannot go backwards again. So just be real careful about changing your plans. If you got questions, go to our website. And we'll help you out. Call us, 1-800-562-2957.
Okay. Angie Cotton asked us a question earlier, and she said she wasn't tuned in for the response, but she asked, can you rewatch it? Yes, Angie. This will be posted as soon as we're finished with the live. It'll be posted later on. It'll be uploaded. If you're a streamer, you can watch on Roku and Amazon Fire, as well as the Ask the Experts page on WLBT.com. We put the past episodes there after they've gone live.
That's great.
Okay. So, about non-discrimination, what is an essential health benefit?
Well, essential health benefits are the benefits that are allowed, or you've got to have these benefits if you have an insurance policy. When the ACA came out in 2010, Mississippi chose those health benefits, and the same all across the nation, basically. One of the things that we put into those health benefits, the 10 of them, or I'm going to cover them: prescription drug coverage, emergency services. We're talking about emergency room services, hospitalization, outpatient services when you may have an outpatient service at a hospital, maternity and newborn care, pediatric services, which are very important. That includes also oral and vision care, which I think Angie had asked about earlier today. Laboratory services, which you really need to have if you're in the hospital. Mental health, and mental health parity is a big deal. If someone's listened to the debates on the governor's race, everything's about mental health, and we can't bring that enough to the forefront. We included mental health parity and the 10 essential health benefits that we thought were available in the state of Mississippi that should be there, and they're there. I'm a big believer that if somebody needs mental health, you ought to help them out.
Sure, definitely.
And that's a big deal. So those are the 10 essentials that we cover in the state. Now, any other mandated benefit that the legislature may add to any of the policies, and they're very careful about this, the state has to pick up and pay for. So I was very particular when we picked these 10 essential health benefits back in 2010 to be certain we didn't dig ourselves into a hole. And actually, we've been very, very fortunate. Instead of letting the federal government do it, we did it ourselves.
Right. All right. Cynthia Johnson says, what about people that don't have any income? They need insurance.
Now, Cynthia, if you have income and you need insurance, we would suggest that you go to the ACA. That's healthcare.gov, www.healthcare.gov. And if you don't have a computer and can't get there, call 1-800-562-2957 at the department. It's on your web screen, and we will help you out. But you can find affordable health insurance. If you make less than the 100% of poverty level, which I believe is around between $13,000 and $14,000, my memory is just not that good this morning on poverty levels, then you cannot qualify to buy on the ACA. You have to try to get help off of Medicaid, and that's hard to do. Medicaid in Mississippi is real hard to get on.
Okay.
So we can help you if you don't have a lot of money. Go to the ACA. Now, here's the good news. We have another carrier that's entering the marketplace in addition to Magnolia or Ambetter. We have Molina, who will be selling policies in 36 counties, and the Jackson area is covered, and those counties are covered. So we now have
something new's coming.
Yeah, they're brand new, and you have another choice, and you have a little different network situation. So it's a benefit to the consumers of this state. I have a job that you've got to be a regulator, and some people don't agree with what we're doing, but my job is to take care of the consumers of this state, and I take that job very seriously. So if we get criticized for having somebody else to what's often known and referred to as Obamacare, so be it. My job is to take care, it's a law, and I have to follow the law of my consumers in the state, and that's what we do.
Okay. Yes. Would that be the same response for Cynthia asked about people that don't have any income? Someone says, my mom is on disability and can't afford insurance. What can she do to get help because she's been having migraines and back pain really bad lately? So would that be the same approach?
Yeah, I don't know how old her mother is, but if her mother's over 65, she's got to be on Medicare Part A. That's automatic, and she has a Part B or D. She'd have a basic Medicare or an Advantage plan. So she needs to look at that real close. That's a big deal. And I hope I answered the other lady, Cynthia, whatever her name, she'd asked about.
What was the name of the website you told Cynthia to go to? I'll type it in the comments.
www.healthcare.gov.
Healthcare.gov. All right, Cynthia, I just posted that in the comments, so you should be able to click directly. The Department of Insurance, you guys are you're tagged in the post, in the copy of the post above, so they can probably reference you there as well. But give everyone that website just in case, because everything's on your website, right?
www.mid.ms.gov. Now, there's another program for Cynthia's mother that may help. It's called the Senior Health Insurance Program. We call it the SHIP program. And you can go to the SHIP program. It's shipta.org.
Okay.
And that's not on the website because I'm catching y'all off guard here a little bit, but that's just something that you can look at for help if you're over 65 and you're unsure about what to do, and especially if you have migraines. I'm not a doctor and I'm not making a prescription, but I know a lot of people that take magnesium citrate or magnesium oxide prescribed by a doctor for migraines. It seems to help.
Really? That's good to know. All right, let's see. What is non-discrimination? What is non-discrimination in essential health benefit design?
Well, most health insurance companies offer to people in the individual and small market. We're talking about small business markets. They have to include an essential health benefit package. So that means there's no discrimination at all on what we call essential health. And those were the 10s I mentioned earlier. And by the way, I think I left out 2 of them: rehabilitation and habitual services and preventive and wellness service, which is the $25 copay that you would pay to go to a wellness visit for your family practitioner, or what we call a family doctor.
Okay.
So all of those are non-discrimination. It just essentially means, in layman terms, that there's no discrimination.
Yeah,
for
basically.
small groups and individuals.
It's just guaranteeing things.
Yeah, but the real discrimination for individuals in our state is the fact that we have only 2 companies that sell individual policies that are not on the ACA, and that's a real concern of ours, and we've not been able to move the needle either way to help anyone.
Right.
So we're always saying to the healthcare providers, the two biggest ones in the state, you ought to be selling individual policies and not having to go to a website and wait 24 hours to get an answer, yes or no.
Mm-hmm.
The number of policies sold on individual websites in this state are less than 15,000. That is pathetic, pathetic, that we do not have more carriers in the state. And as try as we may to recruit more carriers to sell individual policies, it's just almost a headache.
Mm-hmm.
We're close though. I'm hoping I'll be able to announce another one in competition with these two people, these two companies, not people, before the 31st of October.
Okay, let's see, what did we have? We have a question about common features of health insurance benefits. We're getting short on time here,
Okay.
but there was one following, I think it's kind of common, but it looks like a lot of information is here. Why is non-discrimination in essential health benefit design important? You just told us what it was, the basically what it was, and it seems kind of obvious why it's important, but you may need to elaborate. I don't know.
Well, supposedly,
You're
most
the
of these
expert.
policies are by its terms, a policy or plan, it's got to be that it's none, and most likely that it does not discriminate against anyone, but when the insurer who administers the benefits to a certain category of people, be they young or old or wherever in between, it may impact them adversely based upon their age, health condition, expected length of life, or one of the other prohibited bases that we've already talked about. And some examples would include, and I want to go down the line with these, imposing inappropriate age limits on services that are clinically effective at all ages, and such as limiting the coverage for a hearing aid to those who are 6 years older or younger, although they may be older enrollees for which a hearing aid is a medical necessity. Sometimes I think I'm one of those guys. And discouraging enrollment of individuals with chronic health needs. They say, oh, don't do that, just go to the emergency room. You can't do that, that's wrong. And by placing most or all of the prescription drugs that treat a chronic condition into the highest cost tier, which that's something we have to really monitor sometimes. In other words, they go from a tier 1 to a tier 4. So instead of a $20 copay, you'll have $100. Okay. And then you have requiring a prior authorization for most or all medications in certain drug cases. Companies will try that just to limit people that get frustrated and they say, well, I can't get it approved. I just won't take the drug. And we take a very, very serious look if we find a company doing that. They will exclude costly procedures from coverage such as bone marrow transplants, even though they might be medically necessary for people with certain types of cancer or immunity diseases. They impose a higher cost sharing amounts for individuals who have such services as emergency room visits more frequently. In other words, somebody goes to the emergency room 5 times a year, there's got to be a reason for them doing that. They may impose a higher out-of-pocket cost, and even though there's some patients with more conditions, it gets rather complicated, but
Right.
I can keep going on and
Right.
on. I
Well,
think we need to
To
probably,
find out more about non-discrimination, could our viewers call your office to
they can
find
call
out more about that?
1-800-562-2957 or
Okay.
601-359-3569, and ask for Ryan or Andy or anybody in that shop, and they will direct you to an expert.
All right, and the number to your office is on the screen that you just said.
Mm-hmm.
There, can they also, because another question real quick, but we're running out of time, so I wanted to take one from Facebook. Common features of health insurance benefits, is that on your website that's on the screen
Yes, they're on
too?
our website, the
Okay.
common features to health benefits, and that's what we call the 10 essential health benefits. Now, these
Okay.
are bona fide policies now.
All right. So good. We'll have time for Mary Jordan's question before we have to close. She says, if a young person just starting out, should they shop for insurance or just accept what comes with the job?
You should shop for insurance instead of, and if you accept what comes with the job, you may be getting a benefit that's a paid benefit as part of your employment. So be sure you know what you're getting from your employer versus what you have to pay for.
Okay.
But definitely look around. That applies not only to health insurance, it applies to automobile insurance.
Right.
And we are going to announce one company here in Mississippi dropped their rates yesterday, 19% drop.
For automobile insurance?
All new people, 19% drop. That's unheard of.
Wow. I wonder if a lot of people are going to switch over to that company.
Well, I'm a little ahead of the game.
Yeah.
You know, I get fussed at, and this is sometimes for mentioning names on there, so I won't do that.
Uh-oh. Yep, let's not get you in trouble, but let's go to the Ask the Experts page on WLBT.com to see when you're coming back, Commissioner.
Okay.
That's coming. You'll be back again this month, October the 23rd. That's next week at 2 p.m.
That's correct.
Right. Do you want to throw a topic out there for our viewers for that episode?
I'm not even sure what we're going to talk about.
All
I'll tell you probably what we're going to talk about is property and casualty insurance, but a little bit. But we're going to really concentrate again on healthcare because to do some of these programs, we got funding and some of these questions and answers to the questions from the U.S. Department of Health and Human Services. That's HHS. Something called CMS. That's the Center for Medicare and Medicaid Oversight Services, and CISAIL. That's the Center for Insurance Information Oversight.
All right. So that was a whole lot. But if you have questions about healthcare, as you said, healthcare, health insurance, or what you did throw a little topic out there that you said maybe we can talk about.
We won't talk a lot about property. We're going to talk about health insurance,
property
basically.
And casualty insurances, or healthcare and health insurance.
Well, the reason I bring property, I want to bring this up because the reason I bring property up, if you don't have good health, you can't take care of your property, and that's what we're trying to your personal life. So that's what that's about.
So send us those questions for Commissioner Cheney to our Ask the Experts page on WLBT.com. Thank you for coming in, and we'll see you on October 3rd or 22nd?
23rd.
2 p.m.
23rd.
See you then. Send us your questions. Thank you for your questions and for watching today. Have a great day.
Thank you.